is Robin Tramposh, and I'm one of the physical therapists working at Whitman Hospital and Medical Clinics. I have been treating children, men, and women for incontinence for almost 20 years now. Incontinence is the voluntary loss of urine or feces. Studies show that 25 to 35% of the population have dealt with this problem at some point in their lives. The causes of incontinence may be varied, including pelvic floor weakness, obesity, prostate problems or prostate cancer with surgery, neurological disorders such as multiple sclerosis, stroke or Parkinson's, back injuries, and other specific problems as well. People oftentimes have difficulty talking about incontinence. They may feel too embarrassed or anxious to speak with their healthcare provider. Or sometimes they feel that this is just a permanent consequence of getting older or having had children. But this isn't true. Incontinence is always a disorder, but it can be treated. It can be treated by exercise. It can be treated by a change in diet. It can be treated by bladder retraining. And also there's medications and the last resort, surgery. So let's take a few minutes to talk about some common questions or misconceptions regarding incontinence. First one is, incontinence is not an old person problem. I have treated people with incontinence from the age of 6 all the way up to 94. Children often have incontinence problems manifested by bedwetting, or they might have some leakage of bowel or feces while at school, during sports, or when they get nervous, and we can work with this problem. Drinking less does not help your bladder. It can lead to incontinence, and in some cases it can even lead to kidney stones. Your bladder needs the fluids to flush itself out and prevent those toxins from building up and causing infections. There are some foods that will irritate your bladder, such as caffeine, and caffeine is found in coffee, in tea, in some soda pops. Also, artificial sweeteners are bladder irritants, as is alcohol. There are other food groups that irritate some people, and you would have to talk with your healthcare provider about this to see if perhaps that is a problem for you. Cold weather can make your bladder contract harder and also sooner than expected, leading to some accidents. Obesity can trigger incontinence. However, elite athletes can also have this problem. There have been studies that show that 1/4 of female athletes may have had incontinence episodes due to the intense physical activity putting stress on their pelvic floor muscles. And finally, there are devices that you will see advertised on TV and in magazines that say they can cure incontinence, like some magic chair you sit in that provides a current that strengthens your pelvic floor muscles. Don't believe it. Kegel exercises can be immensely helpful. I've had people say to me, though, I've been doing Kegel exercises for the last 100 years and haven't seen any results. And men will say this, women will say this. When we do an evaluation, we find out, wow, I've been doing the exercises incorrectly all along. And once instructed in the proper way to do it, the problem can resolve. So, in conclusion, if you are experiencing incontinence episodes, you're not alone. And there is help. Talk to your medical provider, and we can devise a program for you. Thank you.